In this segment, we're going to do a technique for a posterior innominate rotation on the patient's right side, using a technique that we, for years, called an HVLA long-levered technique with a combination short-levered assist at the PSIS, which in the Atlas of Osteopathic Techniques we've moved into the still technique category. Right side, posterior innominate rotation. I take my left hand's hypothenar eminence and a little bit of the heel of my hand, capturing the PSIS on that right pelvis, helping with a little forward push to the umbilicus. My other hand reaches down and grabs the patient's right tibial tuberosity. I take this patient through a few hip flexion, external rotation, and extensions to make sure they have the full range of motion. So as we do this, we're going to do this a few times, and then I'm going to ask the patient, after maybe 3 times, to kick back behind them with an extended leg, and that long levered hip extension move with the knee extension from the quads and the positioning will all help drag the posterior innominate in an anterior direction. So here we go. 1, 2, and on 3 now you're going to kick back. 3, kick. Okay. So at the end point of that technique, with the kick, as he kicks back, he's using his quadriceps to extend the leg and then the lower leg and the knee. As he does that, at the same time he's using that muscle, I also have him in a tension, so that tension's pulling it forward as well. So I have an active muscle contraction with the muscle eccentric tension contracting to pull that leg into a straight position, which then pulls that innominate forward. At the same time, I give him a little nudge with my left hand towards the umbilicus.